Doctor, we are live now.
Arul sir.
Yeah, good evening. Welcome to this edition of how to write article. As we said, no, there's a statement that says publish or perish. It's becoming more and more applicable today. It's not the question of just publishing something for the sake of publishing. We need to publish really good quality articles. We should know how to look into planning the article first and how to do the workup for this, how to write it, and how to have it at a quality where it will be accepted by a good journal. That's one. Two, as we learn more and more about this, I would encourage our TNOA members to start submitting more and more quality articles to the TNOA journal. We need to push up the journal's impact level to a much higher level, given the kind of quality that we have, the amount of talent that we have in Tamil Nadu, the number of PGs that we have, the number of training institutes we have. The Tamil Nadu journal is actually lagging behind the impact factor. We are all failing somewhere. Maybe we're all going beyond our own journal, so we should start using our journal as the first publication. At least each one of us put 1 or 2 publications every year, and go up the ladder to bigger journals also. So enjoy this good art with the program that has been curated by the ARC. Atik, please take over and lead this on.
Thank you so much, sir. A warm welcome on behalf of the Academic and Research Committee and the Tamil Nadu Journal of Ophthalmology team. We've got together some wonderful speakers mixed with speakers with immense publications and upcoming speakers. The purpose of this session is to encourage fresh presentations and to handhold people who need help. My heartfelt thanks to the editor of TJOSR, Dr. Jayanthan and Dr. Prasanna for having come forward with this. Sincere thanks to all speakers and panelists. Looking forward to a great session. I will be failing in my duties if I don't acknowledge the work of the current editorial team as a whole. I see every edition that has been got out has at least one international author's content in it. So hats off to you. Looking forward to this journal going great guns. Thank you so much. With this, I invite our editor, Dr. Jayanthan, to come forward, please.
Thank you, Dr. Atik. So good evening, everyone. So it was a nice opportunity for us to actually take the journal's visibility forward. As Dr. Atik said, definitely the publication numbers and the content quality, everything is definitely becoming truly global. Right from a regional issue, we are going globally, and there's been a readership which is increasing throughout the globe. So thanks to everyone for the complete support. So moving on to the presentation, I'll be introducing the panelists and the conveners, and I request the conveners to take forward without much delay. We'll move on to the main session. Prasanna?
Yes, sir. Sharing the screen, sir.
So, first, I take the opportunity to introduce Professor B. Sharmila Madam. She is a professor in the Department of Ophthalmology in RIO-GYH.
Sir, Dr. Pramila, sir.
Pramila. Dr. Pramila, Professor Pramila, Professor of Department of Ophthalmology. She has completed her undergraduation from Stanley Medical College, post-graduation from Madras Medical College, and ma'am has been awarded the Best Doctor Award in Government Thiruvarur Medical College in 2015, Omandurar Medical College in 2019, RIO-GYH MMC in 22 and 24. That was a great achievement, ma'am. We welcome you for the CME, ma'am. Next, we have Dr. Sarana Baba. He is a professor and unit chief of Department of Ophthalmology in Vinaya Mission Kripananda Variyar Medical College, Salem. He is an enthusiastic teacher, judge, panelist, chaired by many national and state. He has chaired many national state conferences, and he has 12 publications to add to his. And he was awarded as one of the very few outstanding ophthalmic teachers of India by FOTA at the RP Center, Delhi. Welcome you, sir. Next is Dr. Shubha. Ma'am has done his MBBS from KMC Medical College, 2003. She has done the post-graduation from RIO-GYH Chennai, He has long-term fellowship in medical retina from Shankar Nethralaya 2011, and currently, ma'am is the associate professor at Sri Balaji Medical College and Hospital. Welcome you, ma'am. I take the privilege in welcoming Dr. Pratibha Devi Nivian. She is a consultant at MNA Hospital, and she is an associate editor of our journal for the past almost a decade. Her special interest in thyroid disease, and she has got more than 50 publications to be added to her credit. Next is Dr. Karthikeyan. Karthikeyan actually works as an associate professor of ophthalmology at Jimbar Pondicherry. He's the next assistant professor of RP Center, Delhi. Post-graduation and senior residency from RP Center. He has got 72 publications and almost 25 chapters is author. And he is an editor of the book Childhood Glaucoma. He's received the Young Researcher Award. So now I take the privilege of introducing our conveners of the day, Dr. Prasanna Venkatesh. So if I had to introduce Prasanna, I think I need to write a book on him. So I'll keep it simple, Prasanna. So Prasanna is the associate editor of our journal. He is a research director at Glaucoma Head at Mahatma Eye Hospital, and he has got the maximum number of publication, almost he has published 17 chapters and 54 articles. So welcome, Prasanna.
Thank you, sir. Thank you.
Samir Chaudhary, he has completed his ophthalmology from Arvind Hospital, Madurai, and is currently the consultant at Arvind Hospital, Madurai. He's an executive member of YOC, and he is a peer reviewer of our journal. He has got 3 books authored, and he is very enthusiastic, prolific writer, and he has got many publications which has been published in the journals in the recent half a decade. Welcome, Dr. Samir.
Thank you,
So,
sir.
I hand over the session to Dr. Prasanna and Samir to be taken forward.
Thank you. Thank you, President Arul, sir, Atik, sir, our ARC chair, as well as Jayantan, sir, for mentoring us, the editor-in-chief of TNOA. And we are having the second capsule of the journal as well. And without much delay, introducing the first speaker of the day, Dr. Devendra Maheshwari, sir, who's going to speak to us on choosing a niche in clinical research. How does it help? A few words on Sir is a long-term glaucoma fellow from Arvind, and he has done various international fellowships, more than 50 publications in national and international journals. He has also won the Best Glaucoma Paper Award at our TNOA conference, and is a reviewer of many journals, and he has won the WGC and RO grants and many more awards and accolades to his credit. Devendra Maheshwari, sir, over to you for your talk on choosing a niche in clinical research.
So good evening all. Thank you TNO and IRC team for giving this opportunity. So just I'm sharing my screen. Can you share my slides
No, sir.
now? My slides visible?
No, sir. Samir, can you see it? I'm not able to see.
No, not visible, sir. Not visible.
Shall we take it next, sir? We can move to the next speaker and come back.
Yes. I'm not. Can you see right now?
No, sir.
Just a minute. Now?
Now yes.
Can you see my presentation?
Yes, sir.
Okay. So thank you once again. So it's really very important to choosing a niche in clinical research. And I will tell you how it's going to help not only me, for everyone who is interested in the clinical research. So what is the niche in clinical research? Niche is a specialized area where you want to work, what you want to do for your research, I mean, what's your field. Why it is needed? Because once you have the niche in particular subject, you are going to be far behind than the normal people, and it make you valuable, and really you will be the champion in that particular subject. So define the niche. What the niche? Niche, look for the specialization. You can become a like a leading expert in a specific scientific or academic domain through the extensive and focused research. It may be the new discovery, you can have the new technique, you can have the new finding, or you can put some fresh knowledge which was not overseen in particular subject. Then look for the long-term commitment. Engaging the niche is not like we do something for a certain period. Sometimes it takes decade and more also to make the significant impact on the in the literature. So research need is a topic, a commitment to become a specialist. It involves dedicating substantial time and effort, particular area with your scientific and academic field. So I think some of my speaker are going to speak it. So I'm just saying the first thing, you have to have some thought, some idea should be in your mind what you're going to do. Then you have to go for review literature, then plan your study and design, then look for recruiting, participate in collecting data, then go for analysis, and then again that simulate the result and look for the articles, which article is suitable for your work, who is going to recognize your work. Sometimes we do the very extraordinary work, but is not accepted because sometimes too extraordinary is again the too rare to publish. So that keep in mind, we can publish the very easy and small things also. So Abrin is at the 4 character. It should be utility, it should be specified, it should be complementary skill, and it should be the experimental depth. There should be some depth of knowledge you're going to provide. So look for the utility. It's some interesting, rare, and invaluable information we are putting into the literature. So just I said, in 2014, when we started doing the using this mitomycin C. So in mitomycin C routine practice, I learned as my fellow to use the MMC as a sponge actually. It's a routine technique. But in 2015, we have started again giving the injection. Really, I get questioned by so many people when I presented my paper. I was right like anything. How you can give the injection? It can be do this, it can be do like this. But again, what you do, you have to prove it. So what I found, go to the literature, there's really hardly any publication in 2020. Before 2020, only 3 studies published, which are saying injection MMC is much better than the sponge. So this is the 4th study we published and really put forward the new things. Probably this is also the first study in Indian literature done by the injection MMC. Then again, we look for some huge gap in India, this MIGS scheme, but nobody is coming forward and showing the result. So we did the first MIGS study where we published the outcome of the combined phacoemulsification with ab interno trabeculotomy versus phaco. So this is the one of the first RCT for the microhook trabeculotomy is called the Tanito microhook trabeculotomy. Then again, a lot of people are doing the GAT. So again, we publish this another study of the GAT. I will come later on. So just we have to think about it. What do you want to do? You have to specify particular area and we have to stand out for that. So then first we started the first study as I told previously. So first year we published the 1-year outcome of the injection MMC versus sponge. Then next time now we understood, okay, we published in Indian population, how the people are not only Indian generally accepting, we are not having the good study. So then we well-planned study. Once you work on particular subject, shows that potential is there, you can do more because a few literature there. Then we published the randomized control trial between the injection versus the MMC in the Journal of the Eye. Then again, we look forward. When you do some study, you can take some part of your study in different angles you can publish or you can put some results forwards. Then we publish this in the outcome in phacotrabeculotomy also. So the key element of your niche is your passion, your skill, and your opportunity. When we talk about the passion, really you should have something inside to do and you want to do for long term and you have to keep interest in that. But you have to need this really, you have to expertise some of the skill, you have to learn some of the new things to do good. Then look for the field opportunity, recognize the gaps where the research is not done and what the research is going to make a significant difference in clinical practice and patient benefit. So identifying the promising research areas that pinpoint your core problem, find out the exact issue and that issue has been not resolved and really look for the areas where where you can produce the novel information, methods or perspectives and look for definitely some of your personal interest also, some disliking, some have to acquire the new skills also. Then look for the experimental depth and complementary skills also. Once you select an area, focus and build your experience in that. It's not like we thought one subject, it's not necessary one subject we can stick, but we should know where we want to work. Then expand your experience with that spectra. So coming back to my MIGS journey. So MIGS, I published the first GAT paper. There's a first Indian study outcome of the FACO versus GAT alone. Then we look forward what we are doing. So just we look for the one subset of that. Then we publish the outcome of GAT in juvenile open glaucoma. Then again, we thought I'm doing, so let the other people do. Then we make the IG video, how to do the GAT, how to master in the GAT. So published an IG video, so going to help for the new beginners to all the others who are just learning the GAT. Then once you do, then we experiment more, working in normal case, then we go for some other case. So publish some of the extraordinary case. Now we do get in a various other complicated cases or challenging cases that I think we are going to publish soon. This is also going to help to others and make a significant difference. So this is how my MIGS journey started with Tonito microhook, then GAT, PENG, KDB, absolute goniotomy, I-went, and furthermore, I don't know, I'm still learning. So look for this, all the procedure. Once I started my journey 5 years back, I hardly do GAS. Now in my hospital, I do almost every kind of GAT. Every kind of MIGS we perform. So what's the benefit you will get? Once you choose the particular area, definitely you're going to get recognized. People will understand your work. And that's the reason I was called as an instructor for MIGS Wet Lab at WGC. Then apart from that, it's not like this advantage. Once you work in a specific field, people know you, people recognize you, what you are doing. So by this only, I was invited as a speaker, chair, and the various conferences. I'm just giving the example of the WGC, this upcoming conference in this month only. So apart from that, you can research not only do just for research, you can advance your career, you can get the recognition, you can learn the new thing. And definitely, if you are good at that, you can get the monetary benefit also. So in the same line, we are developing, by doing the work in this field, I'm developing some of the new surgeries and making some new advancements. So this published that absolute goniotomy, popular in US, but in India, nobody is doing. We did the first study and popularized it. Then you can make your nice network also. People, once you do work, people will recognize you. Then I'm working with Dr. Grover and Fallman also to developing a new novel surgery for the glaucoma. It's called interventional valve enhancing glaucoma tuberotomy. So in this procedure, what we do, we really hardly damage the trabecular meshwork, and we increase the pulsatile flow by minimal damaging to the tissue. So this procedure probably become the more popular. Then I get the chance to meet Dr. Tonito, who is the inventor of the Tonito microhook, and right now in India is very, very popular MIGS, and one of the easiest way MIGS to do. Now coming to what we learn. So what we learn is always our responsibility to teach to others, to transfer to others. So I give you some of the example who is working with me in the same area and really what they achieved in a very short span of period. So Dr. Madhvi, he won the 3 hat-trick treble grant about WGC 2023 APO, 2024 WGC 2025. Then he constructed the instruction course at APO Bali, and he won. I'm sorry. C won the best podium poster in ACRS, AAS International Hero, and best paper in the TNOA also. And coming to my another colleague, my fellow, then Dr. Nimrita, he also conducted instruction course at the ACRS Los Angeles. And really, she had a lot of bombard with a lot of MIGS work in ACRS paper, poster, video. And then she also won the 2 treble grant, WGC 2023 and WGC 2025. So 2 treble grants in a very short period of career and within 3 years is outstanding. And once you work, really you work recognized. See, won the best paper in midterm conference, best video in this midterm conference. So my aim is to say, when you work, you will get the recognized by the other people. So there is always your man behind you and someone you to recognize you. So his mentor is someone who always allow you to see hope inside you. And I am greatly indebted to my mentor, Dr. RK, who inspired me still now. So just to summarize, finding your niche, focus on topic, developing depth, knowledge in that, expand your spectrum which you are working, and always teach to learn more. When you want to learn more, teach to learn. You have to learn more than you can teach, and really, it's going to help in a career advancement. And always have a quest to learn more because there's a learning has the no ending. So just most important, keep going. You will get there at the end. This is my team. Thank you for patience listening.
Thank you, Devendra sir, for showing how you publish in your niche specialty, where and all it can take you. I would like to call upon Professor Pramila ma'am for her valuable comments on this talk.
So, good evening, all of you. It's a very nice presentation from sir. It's what we coming to say is what the field which we excited or those we are too much involved. We will go into the details of that field. As the sir told, he shows all the experience about different international presentation. And the word, when I Google out the meaning for niche, it comes from this thing of nurses improving care to the health system elders. So it's like the word comes from that angle, like it's from the geriatric care. So such a involvement, if you pay to that particular kind of patient, you can feel the gap between the existing system and what is required for that system. If you go into the detail of it, you will have one niche. So if you go into the details of that, the youngest ophthalmologist can choose a niche accordingly, and they can go ahead with that. They can achieve and they can stand out from any other person in that field. Sir gave an excellent presentation of that. Thank you so much, sir. Thank you.
Thank you, Pramila. Thank you.
Thank you, ma'am. With that, we'll move to the next speaker. Samir, can you introduce the next speaker?
Thank you so much, Dr. Devendra sir and Dr. Pramila ma'am. With this, we'll move on to our next speaker. So it's my privilege to invite another very young and very dynamic ophthalmologist, Dr. Aditya Varman. So he's the director of UMA Eye Clinic, Chennai, and a very prolific cataract and refractive surgeon, also being the head of eco-emulsification training program at UMA Eye Clinic, and has presented at various state, national, and international conferences. He's also the recipient of 3 Best Paper Awards at the TNOA annual meeting, including the Professor C.P. Gupta Gold Medal for overall Best Paper of the conference. He's also the recipient of Best Paper Award at ASCRS 2024 and has performed various multiple live surgery demonstrations, including cataract and smile. So he'll be sharing his experience of clinical research as a private practitioner. And over to you, Dr. Aditya Varman.
Yeah, thank you, Samir, for that very kind introduction. So let me just start sharing my screen now. Yes. Okay, so is my screen visible to you? Yeah, so I'm just going to start now. So clinical research and publications as a private practitioner is a little tough situation. Many a time as private practitioners, we face this conundrum. Why should you even put time and effort into research as a private practitioner? See, when you're in private practice, you don't have a direct impact as opposed to a government setup where you need a certain amount of publications to move up the ladder. To go from assistant professor to professor, you need to have more and more publications. So you sit and wonder why you should put so much effort in the first place. Patients don't directly recognize it. Most patients are, at least many patients will look at the number of publications that you have and walk into your clinic. So it's not going to impact patient footfall as much. And of course, time and resource are quite limited. But let me tell you the impact that it has in my practice after doing a few publications. First, let's go into the positives. What are the advantages that you will have as a private practitioner? You have unlimited access to large volumes of data. So the one of the main roadblocks in an institution is going through the committees, getting access to the large volume of surgical data, not having the speed and autonomy in decision making. There's a lot of red tape surrounding this. You might have to jump through a lot of hoops before you actually get to do what you want to do. In private practice, you also get to report on real world outcomes. When you're having a large patient cohort in an institutional practice, sometimes you cherry pick and you pick and choose patients with that very specific inclusion criteria, which might not be representative of real world outcomes for your average patient. And you also have the innovation freedom. So you have the ability to test techniques without going through bureaucracy again. If there's a specific technique that you have that you do while doing surgery, you are free to access all of that data and take that liberty to test that kind of technique and go ahead and publish the kind of data that you actually want to publish. So these are the advantages that you have as a private practitioner. Challenges are manifold. The most common challenge are time constraints. So what I do is I block some time every week, maybe a couple of times a week. Usually at the end of the clinic days when the patient footfall is not so much. And that 1 or 2 hours every week is dedicated to some form of research activity. You sometimes do not have the correct research infrastructure. Of course, nowadays we have cloud EMRs where you record all of your patient data and it's very easily accessible. And most of our machines also record all the scans, etc., where you can very easily access it retrospectively. Institutional ethics approval is a little tricky because there's a lot of hoops that one has to jump through to set up an ethics board, but this is very easily amended by joining up with another ethics committee close to your clinic. You can do it in a medical college or in another clinic which has an authorized institutional review committee. Statistical help, of course, this is something that's very tricky. You can attempt to do this yourself with softwares, but my recommendation would be to outsource it. You can very easily find biostatisticians, most accessible through medical colleges, will be happy to help you with your research work. So how do you get started? So I would say you formulate a strategy where you find the niche in your subspecialty. For example, if you're a cataract surgeon and you're doing cataract surgery in a large volume on a daily basis, and there is something that you do a little differently, the way that you mark your axis for toric IOLs, or using a software to see whether the toric IOL has rotated or it has stayed the same. This can be a study in itself. You don't have to think in very extravagant terms and think that you have to do something very advanced to publish. It can be a small niche that you're doing uniquely. The easiest way is to do through a retrospective study. If you're a private practitioner, you probably have years of data that's not been utilized. So you can go back retrospectively and analyze all of this and figure out how you can make a study with your data that you already have in your practice. Case series are very easy to do. If there are some rare intra-op complications or some phenomena that you're seeing specifically with some technique that you're performing in your clinic, you can publish this. Techniques are usually modified by many surgeons. So we as surgeons have something or the other that we do uniquely to ourselves. So the way that you place your incision, the way that you mark your axis, the way that you do your chop, all of these can be different kinds of data analysis that you can pick and choose and publish it in its entirety. Also, you can also go ahead and do outcome reporting. For example, if you're doing LASIK, you can measure contrast sensitivity after LASIK every 3 months and publish that also as a data. So writing and submitting, you must ensure that the journal you pick is correct. Many a times we target a journal that is not catering to the niche that you are practicing in. So what you have to do is be very careful and select the correct journal before you take the effort to format your manuscript according to the journal needs. Don't be disappointed if some major journal you submit to turns you down. This is something that's very common. My first 7 attempts at publication were all rejected and they were all at major journals. But what you have to understand is you have to start a little small and then work up the ladder to other journals Because when you start small and you publish in a smaller journal first, then you will know the way you have to modify your manuscript to make it more acceptable to the readership at larger journals. Structure your paper according to the way that the journal specifies. So not all journals will just have introduction, methods, results, conclusion, etc. Many of them will have a different kind of format that they will demand of manuscripts. So please go through the journal website, see the format that they do expect from you, and then modify it accordingly. Consider a co-authoring role. You can't do everything yourself. So when you have co-authors, each co-author can have a different role. One can do the research into the references and do a review on literature. One person can write the introduction, one can be part of the discussion, and one can do the statistics. You have to delegate accordingly. And of course, you can use AI or grammar and other tools to polish up the manuscript. The other tools that you can use are, of course, you use Google Sheets or Excel to record all of your data. Your EMR systems, if you have them, they can be very useful for data storage and extracting it. You have some tools to do statistics as well. For example, you have these tools called GraphPad Prism that also does a very beautiful statistical analysis for a t-test and ANOVA tests, etc., and also gives you p-values. You can use that, but my recommendation would be to delegate it to a biostatistician to do your statistics very well. So the study design, my recommendation would be to start retrospective. That's the easiest way to start off. Ethics board approval, partner with local hospitals, other eye institutes, or other commercial institutional review board committees. You can even use AI to draft the introduction and the discussion, but do keep in mind that many journals need you to disclose the fact that you have used AI. The other things you can also use are reference managers like the EndNote, which will arrange the references for you in the format that the specific journal of target will require. And the other thing is you can also find the right journal by using the Elsevier journal finder or other journal finders online. You can just copy and paste your abstract and it will suggest suitable journals for you. I would suggest you start with specialty journals. For example, if you're a cataract surgeon, you can start with try going to the JCRS, or if you're doing something in oculoplasty, try to submit to a journal of that specialty. So just coming to my case example, so once I was into practice, I realized that most of our refractive surgery outcomes were pretty much better than the published data. But we had a dearth of publications. We didn't really publish our results that frequently. So what I started to do was I started to go retrospectively to analyze all of our data and try to write a few papers out of it. So as I mentioned earlier, it was a long road with many rejections. The first 7 times I'd written a manuscript, all 7 were rejected. And that's when I realized I was missing out on the standard format. So when you're publishing refractive surgery data, you need to publish the standard graphs for reporting results of refractive surgery. So unless you use these graphs and you plot your results in this standardized format, you will get rejected from major journals. So once I went through all the mistakes I was making and I read the journals that were publishing refractive surgery results, I realized all of them require these graphs. So once you start to use these graphs to plot your data, that's when things started to turn around. The first 2 publications I'd done on Smile, actually both of them were retrospective analysis of Smile patients we have done over the course of the last 5 years. And that's the easiest way to start as a private practitioner because you have a gold mine of data that's not been used. And then we went on and we published in an international journal where we published the data on Smile with our new VisionMax 800. And little to my knowledge, what happened was someone sent me a message later that this study was quoted on stage in China in a conference on lenticular extraction by none other than Professor Dan Reinstein, who is a stalwart in refractive surgery. So this is what happens when you start to publish. We can talk anecdotally about our practice, about our experience and our results. But unless we publish our data in a peer-reviewed journal, recognition is a little hard to get internationally. So this leads to more and more engagements and more speaking opportunities because only when you publish and it's peer-reviewed, only then will your work actually be recognized and it also gives you the credibility of your work. I would say you have to leverage your practice's strengths. You don't have to really think very extravagantly to publish. You can identify what you're doing well already, For example, at our center, we had a robust FACO training program where we train about maybe 25 people every year. So what I did was with this, I know that I'm training a lot of people. So we made a study in which we saw how these surgeons were performing with and without the 3D system at our center. And this publication actually won an appreciation award in the IJO of this year. And the key insight was that strong clinical routines can become strong research papers. So just identify what is the strength in your practice and try to see whether you can publish that as a research paper. So the final takeaways are you don't need a lab coat or a university to do good research. Identify the niche in your practice and how you can present it. Target the right journals, go to the journal and read a few articles of the same subspecialty and see what the correct format of publication is, and leverage the strengths of your practice into a possible publication. Just another note for private practitioners, if you keep publishing, you will get grants to do more research, and that can help you buy more equipment along the way. So that's another motivator in case you're in private practice and you are thinking of getting into research. So I thank you for your attention.
Thank you so much, sir. Thank you for sharing your experience for a problem that probably resonates with most of the private practitioners. With this, I would like to invite Dr. Subha ma'am to discuss on this topic. Over to you, ma'am.
Thank you, Dr. Aditya. That was a wonderful narrative from a private practitioner's perspective, from a private practitioner who is dynamic and dexterous by himself. So thanks a lot for that presentation. And we all know that private practitioners themselves are caught in a dilemma of handling patients and tackling the administration and logistics. And the last thing on their mind will be research. But as you rightly said, when they collaborate with like-minded people, when they use EMR, and when they have a proper documentation of the data, they can start publishing. And there is a lot more to be contributed from the private practitioner side in this scientific literature arena. And the proper documentation of data is really important for retrospective and prospective studies. They can initially start by doing case reports and case series, as you said. So that was really a very insightful presentation for the private practitioner. Thank you.
Thank you so much, ma'am. With this, I would like to invite Dr. Prasanna sir to introduce our next speaker.
Yeah. With that, I would like to call upon Dr. B. Harini Krishna. So she is a DO gold medalist and a DNB gold medalist, and currently affiliated as a medical officer, Department of Glaucoma at Arvind Eye Hospital, Tirunelveli, who has published 20 research articles. And she's going to speak on writing your first research article, which is going to be very useful for neophytes out there. Over to you, Dr. Harini.
So are my slides visible?
Yeah.
Yes. At the outset, I would like to thank the TNOA ARC for this opportunity. And my topic would be writing your first research article. So since last few years, before few years, there was not much of importance given to publications during post-graduation. But over the last few years, we see that it is very important to publish even before you give exams. So today's topic, I want to concentrate more on how to publish or how to write your first research article during post-graduation itself, because it's very important that you start early. So I truly believe that what the mind knows, that only the eyes will see. So it's important to have a good clinical knowledge. So the more we see patients and the more we are strong clinically, and the more we will be inclined towards research, and the more we will be able to do quality research work. So it's important that postgraduates, especially, they see as much as patients as possible and do good clinical work, come back and read. Because only if they read and if they have the clinical, if they're strong clinically, they'll be able to know which are common diseases, which are the uncommon diseases, what are the uncommon findings, and what is the lacunae, what treatment is being given, and which patients respond to which treatment. All this is possible only if the clinical knowledge is good. And also, you should not be publishing just because of peer pressure, just because my my friends are publishing or my batchmates are publishing. It shouldn't be like that. So there should be an innate reason to publish, an innate interest to publish. And also it should not be just for the sake of numbers or fame or publication. We should be able to add value to the previously existing literature. So how do you come to a research question or research interest during post-graduation? So first thing is we need to study our patients and our population, because only if we know, like if we study our patients, we will be able to do meaningful work. So as I already mentioned, like what is the common disease in our population, or what is the lacunae, or what is not working, and what should be analyzed. So that is possible only if we have a good knowledge about our patient population. And also it's very important to have a peer group and discussing with like-minded colleagues, like when we were doing post-graduation, we had a lot of good juniors, and like Dr. Samir, like we used to have conversations about, what work he's doing, what work I am doing, and how we can collaborate, how we can do together. So that is very important. And again, subscribing to journals. These days, it's very easy. It just comes in your mail. So just going through those, every month when you get the copy on your email, going through the contents, like what is getting published. So that gives an idea, like, where you need to concentrate and what you need to do. And again, attending journal clubs also gives you an idea of or what needs to be published, or what is not yet published. All that attending journal clubs could also help. So I feel it's very important to find a good mentor in the initial stages. It doesn't mean that you're getting into research work, immediately you need to have your own idea, you need to write your own original article immediately. It's not like that. I feel initially you can shadow someone, like you can have a good mentor, and then you can help that mentor you can learn from them. You can, start collecting data for them. You can write a part of their paper and then learn from them. So initial days, if you work with a mentor like that, then you can, once you get a wisp of what is happening, and then you can start doing your own work. And again, a mentor will not come to you. You have to find your mentor. So if you have interest in research, you have to go find the mentor, and you have to look for them. Like our previous speaker, you will easily find mentors. Like if you look around, you will definitely find our previous speaker, Dr. Devendra sir, is a very good, as he mentioned, he's an extremely good mentor who would even correct your manuscript at 12 o'clock at midnight. So it is important that we go and find someone. They're not going to come to us. We have to go and find our mentor. And initial stages, if we work with someone and shadow with them, it would be a very good learning. And later on, you can do your own work alone. So when it comes to post-graduation, I think you have to start, it's better to start from doing a case report or photo essay or case series. Even though it is at the lower part of the pyramid of research article, doesn't matter, because that way it can get easily published. And once you gain the confidence, and then you can go on to retrospective studies, and then you can move up and up. So when it comes to a case report or a photo essay, so there is a knack. It can either be an extraordinary case or an extraordinary finding and an uncommon finding, or it can be an ordinary case but an extraordinary picture. So both of these could work out. And also cover pictures. Good pictures can also, once you start submit for cover pictures, once you see your name in an article, then you get the confidence and you can start doing better. So just for example, so this case, it was just clicked on a smartphone. It's a case of a pupillary rough detachment. It was clicked in a OPD, and it is, when we looked into the literature, we found that it was very rare. It was not reported. It went on to be published in, this was also done during my post-graduation. We went on to publish it in ophthalmology. So these days, smartphone photography is also accepted in international journals as well. So we just need to know whether this is a common finding or an uncommon finding. So for that, as I already mentioned, clinical knowledge is very important. Again, this patient was a case of morning glory disc anomaly, which is a routine case we see in our OPDs. And this patient had come 10 times before. He had come for 10 reviews. But on the 11th review only, we decided to do a pentacam. He had astigmatism all the while, but then no one had done a pentacam. So we had a doubt and we did a pentacam. We realized that the patient had keratoconus in one eye and pellucid marginal degeneration in the other eye. So it was a combination of 3 diseases in one patient, which was actually very rare. And we went on to publish it. So this way, a lateral thinking should be developed while seeing such cases. Even if a case has come for multiple reviews, a sudden thought can help to find a different entity altogether. And also, as I already mentioned, an ordinary or normal case, but how do you get it published? Like, for example, this is 1 minute ophthalmology in IJO, where we had published a case case of anemic retinopathy and a case of optic, ethambutol toxicity. These are all cases which you can see normally. But the way you present them, in case of ethambutol toxicity, it was presented in a way that how people miss it and how it cannot be missed. So that way, a normal case, but presented in a different manner, can also help in acceptance. So cover images. So the first picture is a benign fleck retina, which is a kind of rare. But the second picture is CRAO, which is commonly seen, but still it was accepted as a cover image because of the image. As I already mentioned, it's a beautiful image. So we should not think that, oh, this is a common thing, this may not get accepted. But if the quality of the image is good and if it looks good, it will definitely get accepted. Again, I want to concentrate on publishing thesis because for a lot of postgraduates, that is the first step towards research. And that would end up being your first original article. And a lot of us put our sweat, blood, and tears in finishing our thesis. So if we do it sincerely and avoid any fabrication or falsification of data, our thesis can be the first original article we publish. And we need not publish our thesis as a single paper because we would have done a lot of sub-analysis. So every sub-analysis can be published as a different paper, or one unique case in that can be published as a case report, or a part of it can be published as a case series. So a thesis can be your source of your first publication, or it can be also multiple publications as well. Coming to rejections, when it comes to writing the first article, 99% it is bound to be rejected because it is your first time and you're actually doubtful. You don't know which journal to submit. You're confused. So this can happen to 99% of your first submissions could be rejected. So it is okay. It happens to everyone. You need to revisit your paper. You need to discuss with your mentor and colleagues, work on the comments, and submit to another journal. So this was my first image I submitted. So when I clicked this image, it is an extrusion of the crystalline lens. The picture was absolutely beautiful. So everyone I showed, everyone said that no, this would be accepted by any journal. So it was such a beautiful picture. But then it got rejected as cover image, as photo essay, at pictures and it got rejected 7 times, and then we got published at the 8th time. So I think we just need to, if we think it is a rare case, or if we think like, you have to discuss with your mentors and know that if it's really worth publishing, you have to try and you cannot give up. So finally, taking the first step is only very, very difficult. Like once you enter into it, once you see your name in a publication, once you have done a good work, and then there is no stopping you, then you will just go on, writing papers and doing better. And it is very, very important to find a mentor. And again, as I already mentioned, the mentor will not come to you. You have to go find your mentor, and you have to, look for someone who's like-minded and someone who can guide, and someone you can look up to. So it is important. It's very, very important to find a mentor in your initial stages in research. And clinical skills and knowledge is of utmost importance. That will only help to increase your quality of the research. And again, don't quit after rejections, and don't publish just because of peer pressure. Just because someone else is publishing, your colleagues are publishing, we should not be publishing because of that. It should be because of our own interest. I would like to end by telling that intelligence and capability are not enough. There must be the joy of doing something beautiful. Thank you.
Thank you, Dr. Harini, for covering all what a neophyte or a debutant researcher would really want to. With that, I would like to invite Professor Saravana Baba, sir, for your valuable comments, sir.
At the outset, Dr. Harini, it was a nice overview and presentation, and it was just like an encouragement for all the neophytes. A few words for the neophytes, just to begin, or just to start. One is that you start documenting whatever little data, maybe it is different or it is rare or even ordinary thing. You start documenting and keep a collection of that. As you said, that beautiful picture of the lens extrusion, capture the images, put it in your library. That will find its way. And there is a format for writing any of this publication, the IMRAD, that is the introduction, the methodology, results, and discussion. And following that, or before that, even the ethical committee clearance. I'll just quote an example. We had a person who was just approached the ethical committee, and that was nothing but the know-how or knowledge of the medical student about diabetic retinopathy. As all of you know, that is a part and parcel of the curriculum itself that outwardly got rejected the first this thing itself. See, that is the implication of putting across the your title or your your work. You should know the worthiness of that. That is one thing. And the other thing is that conflict of interest and the financial disclosures. Many times they are using the financial products, and the company people also will lure you to make a study. It is very pertinent that you make a entry of that. And so also the use of AI. Many researchers or publishers, they outwardly reject you because you have used AI, and you have to mention if you have used AI in whatever means you have just written. And last word I want to tell is about the references. See, we had a analogy of correlation between the diurnal intraocular IOP with the variation of the glucose level. That was the study. But in the references, I found all vague things like mortality related to diabetes and cardiopathy, and maybe there's a small mention about the IUP rise in those people. But so absurd that in the references you quote those which are little absurd and a little not relevant. So that is what I wanted to emphasize. In the last, our research should add knowledge to the previously existing available one. Thank you.
Thank you. Thank you, sir. With that, we will move to the fourth speaker of the day. Samir, over to you to introduce the fourth speaker of the day.
Thank you, sir. With this, I would like to invite our next speaker, Dr. Narayanan Balakrishnan, who is an assistant professor of ophthalmology and glaucoma consultant at Sri Ramachandra Medical College and Research Institute, Chennai. So, sir has presented his research in glaucoma at several international and national conferences, which includes his research on glaucoma diagnostics and holistic management of glaucoma, his research on cognitive function in glaucoma patients at World Glaucoma Congress, on quality of life in glaucoma at AIOC, and has delivered several instruction courses on early detection of glaucoma and glaucoma progression. He has also did his analysis on postgraduate wet lab training. He was also an invited speaker at the South Asian Academy of Ophthalmology, where he presented on approach to glaucoma suspects and trabeculectomy, and has also spoken on 3D printing of glaucoma drainage device for wet lab training. He is also a certified trainer for the use of VR training in virtual reality in glaucoma surgery. Now, with this, I would like to invite him to speak on the scope of research fellowships. Over to you, sir.
Thank you for that introduction. I hope you can hear me. Yes. Can you hear me?
Yeah, you're audible, sir. You're audible.
Yeah, I'm just going to share my slides. Yeah, you see my slides?
Yeah, you
Okay.
can proceed, sir.
Yeah. At the outset, I'd like to thank TNOA for giving me this opportunity to talk about research fellowships in ophthalmology. I'd like to make a confession. I was not a research fellow at Shankar Nethralaya, but there's not a day that passed when I was not jealous of all the research fellows there, because they were always the favorites of all the consultants, because they did all their data entry and participated in all their projects on so on through the periods, invariably got up more surgical chances also. I'm sure all those people who have done research know that very well, and got multiple tea breaks and lunch breaks during their research period. Of course, jokes apart, it was a fantastic opportunity to do research, especially when you're associated with a large institute like LVPI, SN, or Arvind, because of the multiple things that we look at, right? Because in a field like ophthalmology, which is constantly growing, there's a lot of opportunity for cutting edge research. But what you really get out of research in a research fellowship in a large institute which provide research fellowships is, number one, a huge access to data. Some of these data has been over 30-40 years. And when, for example, I did a research on blebitis and bleb-related endophthalmitis and screened over patients for over 30 years. And in that period, I understood all that clinical data that was there and the management of these conditions over a large period. Now, what that does is it helps you make better clinical decisions. Number two, you get a great mentor for life. You work with the top researchers in our institute. For example, Dr. Ronnie George, Dr. Shanta, Dr. Vijaya were all great researchers. They had a lot of research work going on in SN at that point. Because you work with a lot of them, you understand their work, and also they contribute to what you can do differently in your research. All of this definitely contributes towards patient care. You look at the surgical protocols of different consultants over a large period. Now, in ophthalmology in India, all the premier institutes offer different kinds of research fellowships in the various subspecialty, cornea, retina, pediatric ophthalmology, you name it. And they also give you access to data over a large period. The second most important thing is you can always be part of a research that has been ongoing, and you can also start research at a very nascent phase, which can continue to be ongoing well after you leave the institute. That is one of the most important things that you can get in research fellowships in one of the larger institutes. Now, ongoing data over a large period, especially the landmark studies that you can be a part of, are always a great addition to your CV. Now, there are certain basic eligibility criteria for all fellowships, like we all know, because many of you will always look for the fellowships later. But start, like the previous speaker said, start publishing in your post-graduation. Your thesis can be the first publication you get. Get the relevant clinical and research experience and have an aptitude towards research. Because in your interview, especially for a research fellowship, they are going to ask you if you are going to be interested, and they will always look at your thesis. Your thesis is mostly discussed, especially if you're going into research fellowships, and of course, whatever other publications that you have done. Now, when I was talking to a couple of my friends, especially some of them who had done research, we had a very interesting insight that we got. One, it helps in building a strong subject foundation. Writing a research paper and in-depth documentation, especially when there is a lot of review, the natural process helps you in a deeper understanding of the subject by itself, right? That can always give you the cutting edge over the routine clinical practice. Second, a paper is only publishable if it offers something novel to the existing literature. So this always gives you some amount of critical analysis, logical reasoning, and original thought, all of which are going to shape a research-oriented mindset. Third, most ophthalmic papers involve multimodal imaging. While AI can assist in the interpretation, when you individually look at interpreting most of these images over a period of time, it helps you get a better understanding of your imaging modality and understanding the disease. And last, when you start writing in your fellowship period itself, it helps you in revising many manuscripts. You can just be contributing to those manuscripts. You can be aiding your mentor in contributing in just revising those manuscripts. And that constructive feedback loop enhances your own communication skill, your written skills, and definitely helps you in a better professional identity. So one of my friends was telling me that, when he was doing his research fellowship, he got a collaboration with a European group. Now with that collaboration, which he was doing during his fellowship, he in fact got a chance to do a short observation. So your international collaborations at a very nascent phase during your fellowship can enhance your career opportunities much later. Not only do you have to purely be clinical in your orientation post your fellowship, you can also start doing even things like biomedical research or get into teaching or academic positions much easier when you have a lot of research background, right? Especially in a large-scale institute, what really gives you an edge is the interdisciplinary research. Like, for example, I was doing a paper during my fellowship looking at glaucomatous cupping and neuro-ophthalmic causes of disc pallor and the interplay between that. And it helped it in machine learning and putting out a lot of data over that in a large period. Now, what that did is, when we were looking and analyzing at various discs, the opportunities that we had helped us understand the interplay between various specialties. Second is, when there is a lot of data that is contributing, especially for artificial intelligence and machine learning, we are also able to interplay all of this and broaden our horizons in clinical research. Like I earlier mentioned, during your fellowship, especially the larger institutes, you get a lot of access to global collaborations with other institutes where you can provide data subsets for a large type of even machine learning or any other kind of collaborations, sometimes even with companies. All of these collaborations can go a long way in your career prospects in the future. And of course, all of this is going to definitely improve your patient outcomes. But of course, in a country like ours, where research is still at the back burner, clinical practice is still at the forefront of practice, there is a lot of limitation to research. That is, there is a lot of funding constraint, especially once you leave an institute and you're on your own. There's a lot of issue with funding and constraint. There are a lot of institutes which are able to give you good research grant, but on the basis of all the research that you have done at a very early phase, you can help in getting a lot of funding at a later phase. Also, you get a high competition for these fellowships. The number of research intakes per year is about 1 max. They don't take at every intake. So the number of spots you get is also a little lesser. But there is always going to be that edge that you're going to be associated with the institute for a little longer. Third, balancing your clinical duties, looking at your OPD, OT, and then at the end of it, having to enter a large amount of data is not going to be easy at all. So that is the last thing that you want to do. And of course, adapting to all the advancements, even your paper that you have been working on may undergo an entire 360-degree change or 180-degree change as time progresses. So being able to adapt to all of that also is going to be quite tedious. So these are the shortcomings. But that said, all these top fellowships, especially the top institutes, provide you with fellowships in glaucoma, vitreoretina, cornea, neuroophthalmology, oculoplasty, and of course there are a lot of postgraduate, postdoctorate fellowships also which are present. Even in institute like ours at SRMC, there is a PhD program that also is a great opportunity for research, and all of that is going to definitely aid in betterment of your career. So my takeaway from this is research at a very nascent phase at your fellowship itself is going to set the trend for you all through the rest of your life. And the data, the experience, the mentors you develop at that period is going to greatly enhance your career. Thank you.
Thank you. Thank you so much, sir. People tend to usually focus more on medical and surgical fellowships, and research fellowships are often left very unexplored. So thank you for sharing your insights. Now I would like to invite Dr. Karthikeyan to share his opinion about the same.
Thank you, Dr. Samit. I would like to thank Dr. TNOA for giving me this opportunity. It was an excellent talk by Dr. Narayanan. Yeah, right. The research fellowship gives a better opportunity for publications. In most of the cases, publications are necessary. If you want to join an academic institute, for promotion purposes, publications are needed. Even in your clinical practice, if you join, if you showcase your publications, then people will think, okay, you are the expert in this field, so we can refer that specialty cases to you. So definitely the research publications, research fellowships will help in your publications, and it will help you to grow in your career. And one small correction, AIMS doesn't have a fellowship kind of thing. It has a senior, they term it a little different, senior residency, and they train in specific specialty for 1 to 3 years, and they can get the fellowship degree from FACO or something else. And to add on it, as he said, you have to balance between the clinical work and the research work. During my first year of residency, we used to get only 3 to 4 hours of sleep a day. So that time we can't never think about research and all. As you become senior, you can just help your seniors who are doing research by collecting data. That is the first research publication which I got. Later on, when you do independently, you can start with images, case reports, and at last you can go to original article. Before going to publication, you can see the journal, which journal you are submitting. You can see the previous articles in the journal, in which format they want, and everything. Little bit of statistical knowledge is also important when you are publishing original article. Thank you.
Thank you. Thank you so much, sir. Over to you, Dr. Prasanna.
Yeah. Can you stop sharing, Narayanan sir, the screen? Dr. Narayanan, can you stop sharing the screen? Yeah, thank you. Yeah, with that, I would like to introduce the next speaker of the day, a dear friend and avid researcher, Dr. Mary Stephen, who is an MS as well as a DNB and MIM essay and a PDF in glaucoma JIPMER. He's a postgraduate from JIPMER 2018 batch, 3 years senior residentship under glaucoma unit in JIPMER itself, and he's also a postdoctorate fellow. Authored 56 publications in indexed peer-reviewed journals, H-index of 6, and he's the treasurer of POA and a quiz master for several postgraduate quiz conducted by POA. And he's also won many multiple national and state level ophthalmology quiz competitions. So he's going to talk about quality versus quantity. How do you really balance it and move forward? Over to you, Dr. Mary Stephen.
Good evening, all. Thank you for the kind introduction, sir. So today I'll just briefly discuss about the quality versus quantity, which one to prioritize in publication and when. So the first question, actually, do we need a lot of papers before producing an impactful work? So we have discussed so much about providing a quality work. Do we need to have a lot of publications to provide a really impactful work? So one such example came a few centuries ago by Frederick Banting and Charles Best, who had the discovery of insulin and got Nobel Prize for the same, when they had less than 10 publications to their credit. But that cannot be extrapolated to the common population as well as to all the researchers. So in this discussion, we will get an idea about what is quantity, what is quality, and what really matters to get a better impactful work by an author. So overview of this talk will have the purpose of publications briefly, followed by the determinants of a quality publication. A material should be quantified, it should have certain parameters to tell the published material in a journal is of good quality, and what are the pros and cons of considering quality first, and the same for quantity. And finally, which one to prioritize, the quality or quantity. So why we are speaking about publications, whether publish or perish, the statement is really true. So publication will add more knowledge, basically to share our knowledge with the existing literature available, which will basically improve our knowledge and practice patterns. So in an institute, it will be helpful for our career progression, especially if you are working in an institute. Obviously, you need it for your promotion. And also for performing a PG thesis, you will have to have ideas about research. And it is a term for our academic reputation. Now we all have accounts in our ResearchGate, Google Scholar, which will be obviously showing your stats, your read, citation, H-index, item index, which will serve as an academic reputation for an author. So what are the determinants to tell the published material is of good quality? So the journal which we are publishing will be having an indexing factor, their citation and impact factor, and the author metrics. The author metrics is a guide for the individual author whether the material which he is producing is of good quality or not. So indexing, there are a lot of databases available. The commonly searched database is PubMed, which is basically from the US National Library of Medicine, may it be the National Center for Biotechnology and Information. It is free, everyone can access, and citation can be borrowed with the help of PubMed. And any article in a journal, in any journal, if it's PubMed indexed, said to have some authenticity. Web of Science is now based in UK, which is basically a subscription-based research database, including Clarivate, Analytics. It is not an open access, it is not available for everyone, but it's a subscription-based. And next one is DOAJ, Data Directory of Open Access Journals, which is having a huge volume of peer-reviewed open access journals. So even though some articles may not be PubMed indexed, but many of them will be DOAJ indexed, which will help to identify the predatory journals. Predatory journals is a one which will, an initial beginner will tend to follow up. Once we get multiple rejections, he will try to send some journals which is not indexed in anything, even to DOAJ. Ultimately, it will be a predator journal which will not give any career boost. Rather than it will pull back to our back to zero. So better to look for indexing. At least DOAJ indexing should be start for the beginners, and PubMed is the ideal one. That is the norm which is being followed as of now. And there are certain author metrics, commonly as H-index and item index. H-index is basically H papers with at least H citations. So if you're having 10 papers with 10 citations, your H-index will be 10. I-10 index is the publications with at least 10 citations. So if you have more H index, more I-10 index, it means your material which you have produced has a better authenticity and of better quality. So these are some of the author metrics stated. Impact factor of the journal. So impact factor of the journal, our president sir was discussing before, to improve the impact factor of our journal. This is basically by improving the number of citations for a journal. So there is more citations in the journal to the articles available in the journal. Obviously, the impact factor is going to get higher. So I'll just list out the top 3 impact factor journals in our ophthalmology. First is the Progress in Retinal and Eye Disease, which has an impact factor of close to 18.7. Ophthalmology has 13 plus impact factor, and JAMA Ophthalmology is close to 8.8. And our IGO has an impact factor of 2.1. So to define a material which we publish is of good quality, it should get published in a high impact factor journal. There is greater number of citation, more reads, and having a better recognition among our peers. But all this statement holds true, we will see. Getting published, like especially for beginner to get published in a high quality, high impact factor journal will be a lot of time consuming, which may not be having as a junior, especially during our residency or during senior residency for that matter. Our time is often limited. Spending a lot of time for each report will be tedious, and we will often get fed up because of the more number of rejections we are getting. And obviously the number of publications is going to get lesser. So it is not because the quality of the material is poor. There will be journal norms, and as such, the acceptance rate of many index journals are less. For example, JAMA Network, JAMA Ophthalmology having acceptance rate of only 12%. And British Journal of Ophthalmology has acceptance rate of only 11%. So basically 1 in 10 articles are going to get rejected despite the quality is being good. So I like to quote another 2 Nobel laureates, this Carrico and Wiesmann, who had Nobel Prize for mRNA with respect to COVID. So they had stated that they had sent their publication initially to a journal Nature, which has a very high impact factor journal, which got rejected within a week. Then they have sent the same article to Science Journal, which also got rejected after peer review. They didn't give up. They subsequently submitted in multiple journals, which got eventually accepted and published in journal Immunity, which got them the Nobel Prize. So even a Nobel Prize winning article may not get a chance to get published in a high impact factor journal because of so many reasons. So we cannot pinpoint the reason. So the idea being the quality cannot just be defined with the journal which is being published. So I would also like to quote some of the articles which I have read multiple times and also recommend my juniors to read. These are high quality contents found in our TNOA journal, which is not found in other high impact factor journal. Despite not being in PubMed index journal or not being a high impact factor journal, this high quality content is we cannot often find in many other journals, not even at least an open access journal. Okay, so TNOA journal also having high quality material despite not being in PubMed indexed or a high impact factor journal. So that doesn't mean the articles which is published in other DOAH index journals is of lower quality. So what are the pros of prioritizing quantity rather than shifting from a high impact factor or high PubMed index journal? So it builds an early momentum, so it gives the confidence basically to the beginner. So often when we will try with a high impact factor journal, which will get rejected within a week time or 10 days time. But if you're going to try in slightly state level journals or on national level journals, it will have a high propensity to get accepted, basically, which will boost our confidence and also shows our active research involvement. So subsequently with publications, it will improve the chance of getting grants as well as fellowships, and it will basically improve the publishing experience. But the main con about prioritizing quantity is falling for predatory journal. So numbers alone is not important. Building the quality is the key here. But falling for predatory journal will just boost to a number. We can tell we have 20, 30 publications, but most of them can be a predatory journal, which basically retrospectively an inspector will not be going to serve any purpose. For example, in my institute, if you are going to have a publication in predatory journal, it's basically not having any publication because it should need some indexing, at least PubMed indexing. And DOAH indexing is still acceptable. So if it's not even indexed in DOAH, then the publishing an article is not going to make any much benefit for a career growth. And IGO has listed 53 ophthalmology publications, which is basically labeled as predatory journals. So people can go through this to identify what are the predatory publications available. So can quality and quantity go hand in hand? So for a beginner, I'm not a very experienced person. I've just started my research for the last 3 or 4 years maybe. My first publication is a case report which got published in Indian Journal of Surgery, which is a PubMed index journal, which is not the first case to be reported in post-traumatic Weber syndrome following a trauma where she inserted something through her nose, had a midbrain injury resulting in Weber syndrome. So this gave me a boost. That first publication of me became a PubMed index journal. So I started writing more journals, and I have also faced a lot of rejections. So sequentially in 2020, 2021, that COVID end to second wave of COVID beginning era, I started writing more with the help of my seniors and with the help of my mentors. But most of the article, I will always go for a high impact factor journal, which obviously get rejected, and go to a national journal, which will also further get rejected, and go to a state journal, which are DOAG index, like TNOA journal, Kerala journal, or like even a Journal of Ophthalmology Clinics and Research is Maharashtra Journal. So all those things which gradually built by momentum. And what I gained from all the rejections was the peer review as well as the editorial review, which will give a lot of useful tips. So I often go to the peer review, editorial review, sit back, revise the manuscript, improvise the manuscript, and send to a further journals for publication. So subsequently, I have seen the articles which I'm sending to an index, PubMed index journals also slowly started getting accepted. So the next 2 to 3 years, I have got some 36 publications in a PubMed index journal, but still I couldn't reach a high impact factor journal. So whichever I starting with the high impact factor journals like ophthalmology or BMJ, case reports or British Journal of Ophthalmology slowly got improved. For the last year, it is the once I got 6 publications within ophthalmology and BMJ case reports, thanks to my mentors for guiding that. But still, I believe always to start, like take the peer review process and editorial process slightly seriously, sit back, revise the manuscript, improvise your manuscript, and don't send back to the same journal, try a different journal. So each journal has their own specific set of rules, one specific set of templates. Go through individual templates and then try to produce your work. So just because our study is not getting published in a high impact factor journal doesn't mean it's not of good quality. So we are not in the state to define the material which we are going to submit is of good quality or quantity. That is based on the citations and it is based on the readership. So our duty is to write a better quality material and to submit to a journal. So if they are rejecting, go through the peer review and then subsequently plan for other journals. I believe quantity will bring quality. So we cannot just in the first day sit and write an original article or a review article or a meta-analysis or systematic review as a first one. So as every author was like, every speaker was discussing, start with slightly small photo essay, case report, case series, get help from your mentor. Build your quantity. So write your own report, get it corrected from the vendor, get it corrected from the peer review process of some experienced editorial board members. So by that way, we will get more confidence and ultimately that will bring the quality. And in that process, main thing is don't fall for any predatory journals. So predatory journals are always there open, close to 50. So which can easily fall a trap for it. And we will just have the confidence that we are publishing more, but it's not going to add anything to the medical fraternity as well as to our knowledge. So quantity also matters, but subsequently I feel it will build the quality by carefully going through the peer review process. Thank you for your patient listening.
Thank you, sir, for the wonderful enlightenment talk on quantity versus quality. With that, I would like to invite discussion from Dr. Shubha ma'am. Ma'am, your comments on this talk, ma'am.
Yeah, that was a top quality speech from Dr. Mary Stephen. Actually, it was very good that he cautioned the young ophthalmologists to be aware and also beware of the predatory journals so that their quality work does not get, they do not get wasted in bad quality journals. And his journey was really an example of the Japanese principle Kaizen, slow but steady, consistent work, which really gives see, initially, if you follow quality in your initial years of research, it builds up your quantity. So his journey was really an example for that. And quality is a quality which comes not by chance, but by choice. So if we remember that, we can go a long way. Thank you.
Thank you, ma'am. With that, we'll move to the penultimate speaker of the day. Over to you, Samir.
Thank you, sir. With this, I would like to invite the next speaker, Dr. Sindhuja, who is currently working as a consultant in Trinity Eye Hospital, Palakkad and Coimbatore, and has over 6 years of experience in orbit and oculoplasty. She was awarded the best paper of orbit session in AIOS 2022, and she's also the section editor in the TNOA JOSR journal. She has keen interest in cosmetic and reconstructive lid surgeries, and today she'll be talking on building momentum following the first publication. Over to you, ma'am.
Thank you. Okay, so I'll be talking about how to build the momentum following your first research article. So now that you have published your first, manuscript, now what do you want to do next? For most of the researchers will be to publish another one. So like the previous speaker had, Dr. Harini had spoken in depth about how to go about, publishing your first article. So she spoke about how to avoid that starting trouble. So I'm going to talk about how you can continue with that momentum and so you can publish more. So why do you need this momentum and why do you want to publish more? Because apart from our clinicals and the surgeries, we are also largely judged based on our collective contributions to the research and the publications. So we have to establish our presence in the academic community and it can also bring an advance in our career. So with this perspective, we must constantly spend time thinking about how we can contribute to our field. So the only way to do this is to maintain the momentum in our research program. So how we can do this is by focus on continuous learning, mainly by networking and expanding our research interests. So the main thing you have to do is to avoid momentum killers, especially time is very important in this. So you have to organize your task, you have to learn to prioritize your tasks. So you might have multiple ideas and research questions in your mind. So you have to know which you can prioritize, which will give you a fruitful result, which will be beneficial for you as well as the medical community. So you have to know how to prioritize and organize it. And you also have to know what you want to achieve for the given day, because as you know, writing a research paper is not a one-day job. It does take a lot of time and you have to put in a time every day to do it so that you avoid procrastination, and you can set a timeline so you can do it before that. And another main thing is, I think you should also be comfortable in saying no, because you might get a multiple research questions and ideas from your colleagues, your seniors, your professors. So I think you should choose a research which is comfortable for you, which is doable for you. So I think you should not agree to doing all the research as well. So how you can do this is, from your first published article, you can build upon that itself. So you can identify research gaps, you can explore related topics, maybe like your findings may be similar to other research areas. So you can expand in that scope. You can reanalyze the data and you might find different results which you can publish as another study as well. You can develop a new hypothesis from your your original first article. You can even conduct it as a follow-up study as well. So another thing would be to identify your research area. It would be better if you can focus on your specialty, as it will help you build, it will help you become an expert and build a reputable profile. And you should do a proper literature review and stay updated with the latest research in your specialty. And also form multiple research questions. Make sure it's very clear and relevant research questions that address the current gaps. Another main thing is networking. So it's always good to engage with the research community by attending conferences, workshops, seminars, webinars. Like in our Tamil Nadu Ophthalmic Association, we do have amazing surgeons and clinicians, but we do have multiple people who are very, very interested in research and publication. So I think you should always take help from them. You can discuss ideas with them. I'm sure everyone will be ready to help and give you inputs. So that seeking mentorship is very, very important, as it gives you the push and the guidance.
And you can even collaborate on projects. You can be co-authors with others and give your ideas and inputs to them as well. And another thing is you can share your work as they give you feedback, and it also gives you good exposure, especially sharing it on on online platform like ResearchGate or LinkedIn as well, and even on social media platform like Instagram also currently does give you a good exposure, and people can give you good feedback from that as well. And it is good to maintain a visibility in for the networking. Nothing would be to refine your skills and communication. So always it's good to improve your writing and set goals and schedule your writing sessions, and to develop your presentation skills as well. And it is also good to learn how to analyze your data, not always depend on a statistician for it. So you can be up to date on the statistical analysis as well, and always seek feedback. So another thing is to seek new opportunities. So identify target journals which will align with your research and the target audience, and develop a publication strategy, that is like plan the writing and the submission timeline, within how much time you want to finish this work, and everything like that. And try to seek funding opportunities as well, and pursue for research awards and fellowship, and also collaborate on the publications. Another thing is this peer review process. So it is one of the toughest process you go through as an author. So after you submit an article, you should always be prepared for the constructive criticism and respond thoughtfully to the reviewers' comments, and make necessary revisions as well. Suppose if your article is rejected, take it as a positive feedback and revise on it and submit to another journal. Don't get motivated if it is rejected, so that this doesn't stop you from slowing down your momentum and not doing any more publication. So I would like to conclude by saying that create a pipeline list of possible articles, topics, case reports to maintain the focus and the momentum. Bring out an outline of the future article which you want to do. Identify new ideas and the research questions. Be organized, because if you're organized in your ideas and your data and your writing, the way you portray your research is much there is more clarity in it. Set targets and timelines, and always stay updated. Use the online platforms, and always reflect on your progress, and stay motivated and inspired. Thank you.
Thank you. Thank you so much, ma'am. A very useful talk for people who have just started their journey in clinical research. So I would like to invite Dr. Pratibha to share her insights on this topic.
Thank you, TNOA, for giving me this opportunity today. It was a very good talk, Dr. Sindhuja. So my insights as a private practitioner, why we should not lose momentum after the first publication, or the start or stop doing research, or the stop doing clinical or academic work. Because as you age or as you become older, if you are not updated, or if you are not into the field, then you feel like you are not updated in the ophthalmic fraternity. So this research or this type of academic work will keep you, or will give a push for you, and will give a more recognition to you in the society. And for that, you should catch hold of a niche, like Devendra sir beautifully told. Catch hold of a niche which you are interested in, or which you feel is your strength, and you keep working on that, or you can do research in that. That is what I feel about research, and that is what is keeping me doing that also. So, and coming to research, particularly with private practitioners, collaboration with a team is very important. We do collaborate with so many people, so that your strength and their strength will become a lot of more publications. So ultimately, many of you are benefited. So collaboration is a very important thing when in research. And then, as everybody said, many of them said, there will be a lot of rejections initially, but all those comments and all those valid points which the reviewers give should be incorporated and taken into in a positive sense, and then that will make the paper or the publication much better and more beautiful. I really liked Mary Stephen sir's words that quantity will bring quality. I do feel that I'm not a perfectionist, but then I also feel that the quantity, the more numbers, if I go back and see my older publications, I myself can point out so much of grammatical mistakes, so much of mistakes in that. But then quantity will one day bring quality. That is definitely true. And I would always want to remember Namrata ma'am's words. She's such a great mentor. And she also keeps telling consistency in your work. So if you are an academician, if you are a researcher, you should be consistent with whatever you want to do. And these are my few points. And all talks were excellent. And there are a lot of points taken from all the talks. Thank you.
Thank you. Thank you so much, ma'am. With this, we'll move on to the last talk of the day. Over to you, Prasanna, sir.
Thank you. Thank you, Samir. So moving to the last speaker of the day, Dr. Niranjan Karthik, MS and an FICO and an FCO, a completed person with MBBS from Kasturba Medical College. And he was a best outgoing student with a gold medal. And in MS ophthalmology also, he was the best outgoing student with the Dr. Satya Vakesan Gold Medal Award. And he's a fellow comprehensive ophthalmology at Dr. Nirmal's Eye Hospital and currently a junior consultant. And he's a lifetime member of the Tambaram Ophthalmic Society as well as the TNOA and also part of the editorial board. Over to you, Dr. Niranjan, for your talk.
Thank you, Prasanna sir, for the kind introduction. So I'll quickly share my screen. Is it visible, sir?
Yeah.
Right. At the outset, I would like to thank TNOA ARC and the editorial team, Atik sir, Jayantan sir, for giving me this opportunity to be a part of this wonderful initiative. And so I'm being given a very unique and an interesting topic of conducting research in limited resource settings. So there is a lot of information that we've acquired from such wonderful speakers before. And this topic is going to guide us through certain challenges that we might face, especially if we are in a low resource setting, wherever we may be. And these include limitations with the funds, shortage of manpower, minimal access to equipments, and time constraints considering the busy schedules that we have. But as we all know, innovation is one thing that thrives under pressure. So it is often in such tough situations that the best is brought out. So let us see how to go about it. So the first step in the process would be about getting your study design to perfection. By perfection, I do not mean that it has to be the best study in the entire subspecialty or in your locality. Rather, it should be perfection to your particular circumstances. So one first thumb rule would be to prioritize simplicity. So aiming for the study design which are higher up in the ladder of accuracy and validity, like trying for an RCT, would rather prove counterproductive rather than trying to go for simple studies and study designs. So try to fix or stick to a single outcome study. And in that genre, we have prevalence surveys, clinical audits, or even case series. So why is it a good idea to do that? Because it is quite achievable, low cost and resource intensive, and it's quite very well, as we've heard from the rest of the speakers, publishable as well. And it reduces the data errors, investment of time, and the staff training that may be required in more complex varieties. And often it is advisable to choose projects that are integrated into a daily routine practice. So going out of the way to do something extra may be sounding good, but having it incorporated or choosing it in a way that it's a part of your routine life makes it even more enjoyable and pleasurable to be done. Avoid time-consuming follow-ups wherever possible and prioritize short duration studies lasting for about 3 to 6 months, if not shorter, with easily collectible data. So completing data collection has often been a tedious task for many of us in situations of limited resources. Sometimes it's wise to choose retrospective data where there is no requirement of extra equipments, minimal staff requirements, and patients need not be disturbed for the same. So this data could be extracted from various sources. However, one crucial aspect to ensure is the quality of the documentation that is being followed in the place where we work, because with limited resources, it may not be feasible to capture all the data pertaining to the study of our interest. And one part of it is also predefining the variables and the particulars that we are interested in and whether it's being captured properly. Dependency on manpower is a very crucial factor, important variable. Training 1 or 2 reliable staff or postgraduates in our institution is more than enough to bring about a capable study. Automating the data collection through Google Forms and using Excels can really help and go a long way in ensuring that data doesn't go missed. Avoiding studies needing multiple coordinators or field workers can really help in not missing out on certain important data and parameters. And that means lower errors, lower costs, and better confidentiality as well. Eliminating costly equipment dependency again. In earlier stages of our career where we are expected to be quite skilled and knowledgeable in our clinical acumen rather than being dependent on equipment, we can choose studies which are also designed in that way, capturing and identifying various clinical parameters rather than having technology-based parameters as our study parameters. So minimizing the financial aspect includes using certain softwares, as I've enlisted here. Already Dr. Aditya sir has very well, very in detail mentioned about the various softwares. So based on the purpose of requirement, these are the different softwares that can be employed, which can make our life slightly easier and are not too heavy on our pockets. And like I mentioned, OPD-based convenience sampling is one way to go about to reduce the costing. However, it is imperative that you mention it as a disclaimer at the end of your study so that it makes it more valid and transparent. Reducing the sample size and accurately calculating the minimum size required for statistical significance can go a long way in saving resources, because often this is not being emphasized upon and it results in unduly increasing the sample size and making it need more resources. Time efficient data collection. Often the closed-ended questions having the ticks and the check boxes are a better design for designing questionnaires rather than leaving it open-ended. And storing them in cloud-based softwares can really avoid data loss and information loss. Now, once you've designed it to whatever customization based on your circumstances, now it's time to execute it with precision. So many institutions do offer in-house ethics approval, and it's quite an easy cakewalk if you adhere to the strict protocols and the correct templates, which are often provided free of cost by ICMR. And if we choose a particular design which does not involve too much risk or danger to patients, then it's quite likely that it gets cleared by your IEC. So grants being applied, one point to remember is to do so only if you have adequate time on your side, because availing grants can take longer than actually conducting the study as well. It's also a good idea to partner with NGOs who can help us with both data collection and but it's always advisable to stay away from the monetary aspect as much as possible. And next is to limit the sample size and increase the impact. So what is important here is, like we've been talking about choosing the right niche, it is also important to choose the correct parameter of interest. So rather than trying to have a bite of all possible variables in a particular study, it is good to be very specific about what you want. That again helps in cutting costs and giving you the best outcomes, rather than trying to mention a little about everything that is possibly covered in the study. So often working as a team helps better than working as an individual. And it's important to identify the people with the right aptitude and mindset rather than finding it as an additional burden. And one important point is it is crucial to make the patients feel no extra burden in trying to be back for the continuity of your study by coinciding their follow-up visits with your data collection, so that it doesn't have to be heavy or difficult for the patients too. Now coming to the part where we try to publish it, like we've heard from Stephen sir, it is very crucial not to fall prey to predatory journals. And there are certain journals which offer excellent opportunities for beginners to publish even with minimal or no cost involved. So some have been mentioned here like BJ Open Ophthalmology. So BMJ Open Ophthalmology. So there are many journals which we have to pick and choose for suiting our needs in limited resources. One aspect where we have to really work on, and that makes a huge difference, is improving our writing strategies, because sometimes the very aspect of writing a fantastically constructed or designed article can get us a place in some of the most exquisite journals, and it doesn't have to be always followed or supported by some external support which offers us better quality of writing. So it's good to train ourselves to do that. And we've already heard about using artificial intelligence and the disclaimers that are necessary to be associated with it. And good to break it down into micro tasks. Sitting down one night and burning the midnight oil to try to finish the manuscript can prove backfire. Rather, it's good to span it over certain few days or weeks and get it done to perfection. And lastly, maximizing the existing data can help rather than trying to extend the sample size and trying to achieve our statistical significance. Once we are done with the study, now what next? Often, whoever is doing the study wants to present it in the biggest of the conferences. Rather, there are many local associations because I personally started presenting in the wonderful opportunity that was given by MCOA. During even my PG days, I used to present cases, case reports, and there we got the expert opinion of multiple stalwarts in that particular subspecialty, which helped me further redesign it and draft it for better selection of possibilities and probabilities. So we get feedback which can help us improve our manuscripts, and local recognition also gives us a feel-good factor, boosts our morale, and encourages the institutional support also for future studies. So these are some courses that are easily available online, which can help us be better writers and publishers. So it doesn't happen, haywire and very randomly. We need to really sit down, have it in a part of our timetable to at least spend 30 minutes weekly to upskill ourselves in these aspects. So I would like to again acknowledge this article, and I would like to sincerely thank my alma mater, RIO, for this was my thesis. And RIO was by no means limited resources, but we were having a very, very different challenge of COVID. I was doing my post-graduation during COVID. And if not for the support of my professors and my faculty, this study would not have been possible. And thanks to the editor-in-chief, Jayantan sir, and the entire editorial team for recognizing this article, which was done with so much of difficulty during the COVID time and published. And it received the award of Best Runner-Up Award for Best Original Article. Thank you once again for giving me this opportunity. So final takeaway is resource limited settings. Actually, it works best when there is clarity, creativity, and constraint-driven design. We don't wait for perfect conditions, rather use what we have at our disposal. Starting small, solving real-life problems, and staying consistent is the way to go forward. Even low-budget studies can lead to meaningful change in the eye care at the community level. Thank you.
Thank you. Thank you, Dr. Niranjan, for a practical display of how you can do a study with a low resource setting. I would like to call upon Professor Pramila ma'am again to share her valuable comments and feedback.
It's a very good presentation from RIO postgraduate who did MS in RIO, is a flourishing, budding ophthalmologist. It's a very nice presentation from him. So when the limited resources, not only the money, time, data, everything matters. So we have to choose a primary goal and we have to data collection, analysis, and the articles which is available freely in the all this available in the internet that they can utilize, and the primary goal has to be set in a proper way. Otherwise, if we are deviated from that, we will lose our time and as well as your financial credibility. Everything will go waste, and we will land up in a spurious and fabricated collection of data that will leading on to the quality of the what we are going to do as a research paper will be go in a different direction. That is my opinion. And regarding this, one more question to all other private practitioners who's doing this research work. How will you getting the ethical committee clearance? Since we are attached to MMC, we have to present in our ethical committee as an institutional ethical committee. And this is regarding this. What is anything like any protocol you people are following, like this kilometer, which institution you will choose for ethical committee clearance? I have just an doubt regarding that. How you people will do this? Hello? Is anybody from other institute?
Other panel, Dr. Karthik from JIPMER.
JIPMER is not a problem because I'm talking about the private practitioners.
Pradeepa?
Hello, good evening, ma'am. So we
Hello,
have ethics committee. So we present the cases in our ethics committee.
No, institutional ethical committee clearance. How will you get to Pradeepa, ma'am?
No, ma'am, we have in a hospital.
You have your own.
Yes, ma'am, we have.
Okay.
Because we have a DNB students and optometry students.
Yeah, MN hospital is different, ma'am. I'm just asking a private personnel to conduct us to go ahead.
Ma'am, maybe I can take up that question, ma'am. So ours also, we have a DNB center, but we don't have an institutional ethics committee yet.
Yes, sir.
We have
Yes.
affiliated center, Kaveri Hospital, where once every year or once every 6 months, when their board gets together, we'll have to pitch our proposal for our PG thesis that we do, along with the other studies that we do. And we'll have to wait for the ethics board to have their meeting at that point in time. And that's how we go about it. So for private practitioners, as you rightly asked the very pertinent question, you have to approach your ethics committee board or the institute board that is quite near to you. And if you have an MOU as such, you can also get into an MOU with them.
You need to have any MOU prior to that institution?
Yes, ma'am, we do have an
MOU.
Because
when we are conducting some kind of giving dissertation topic to the postgraduates, that is like an interventional studies, like applying some drops and to see the response, because we got a lot of hurdles in that. So that's why I'm asking that for a particular question. If it's pertaining to that institution, we've got a lot of things and as problems. So how it go about in a private practice? That is somewhat, it's a difficult situation for them. That's why.
Can I add something, sir?
Yes.
Yes, madam. So regarding this, there are some new initiatives by individual bodies like Indian Medical Association, madam. So IMA Tambram has recently, for the last 3 months consecutively, been holding a monthly institutional ethics committee board. So this is not attached to institution. However, in my understanding and knowledge, we don't even need an MOU from the institution's perspective. Rather, an individual practitioner, even if it's a small clinic, however, a member of that local IMA, if they do have an institutional committee, they can definitely apply priorly. Theirs will be reviewed and approved by the ethics committee of that local IMA. That is also.
It's nice information. Yeah, it's new to me. Yeah. Thank you so much.
I just have a question.
To add to that, for individual, many individual practitioners have also presented in our ethics committee that an MOU is not needed, ma'am. Only if the institute has DNB students, then probably MOU is required, because that we have to submit it during the accreditation time. During the accreditation process of DNB, we'll have to submit the MOU. So individual
Okay.
practitioners or individual doctors, if you want to do a study and they have to do the ethics, they can present it in the organization where they regularly conduct this ethics meeting once in 3 months. So they can approach those people and they can present it.
Okay, thank you.
Yeah, one small question. Before ethics approval, is there anything called scientific committee approval before going?
Yes, we have scientific committee clearance first, followed by ethical committee. Scientific committee, they won't do any kind of adverse things. But in the ethical committee, really, if you are going for anything like a clinical trials, they won't accept, and they will ask a different type of questions, and who will sponsor this medication and how long you will treat, and is there any article regarding this drug usage. That is a valid question, but if you landed up in this kind of questions in between your studies or of a dissertation, that time the candidate has to be in a state of finishing or nearing the course of finishing the MS course. That time they will find it difficult. So this is that's why our primary goal is to do it successfully without any hurdles. And this clearance of scientific committee, ethical committee, these are not, I'm not saying there's a hurdles, that we have to keep it in mind when you are giving or when you are taking a topic for your research.
Thank you.
That's my opinion. Scientific committee we have. Then only we have to apply for the ethical committee.
Yeah, institutional.
We have an institutional scientific committee followed by MMC scientific committee and then by the MMC ethical committee. 3 things we have to clear to go ahead with a particular research. So,
any other comments from the panel?
I'm for Tambaram, that IMA, do they also have a scientific or only directly ethical?
So for that, it is directly ethical, sir, because it is multidisciplinary. We have from all different specialities. So there is
that may not be Niranjan because they will have a scientific followed by ethical. There not be a straight ethical committee.
I'm not sure if that has a separate.
Yes, maybe because it's a stage-wise scientific committee and then ethical committee is the next step. Like that, it will go.
Okay.
May not be a straight head, but a straight ethical committee clearance. We can't get it. I'm just saying about our institution methodology of doing.
Okay. Saravana Bhava, sir, you had a doubt.
I just want to add on. Nowadays, the CBME curriculum, especially even holds good for the postgraduates. They have to submit the topic within 6 months of their admission, and that following that there'll be ethical committee clearance that will safeguard them from the last minute problems which Madam was mentioning.
Yes, sir. That they now only it's come to the implementation. Within 6 months they have to choose. That is a very good initiative taken by the NMC.
Yes, and just to add food for thought, I was just going through iTube today. We have been all the while knowing the influence of AI in Grammarly, checkup and references and whatnot. And I come to understand that even AI is helping to recruit the patients for the study. That is, it is excluding and including the exclusion and inclusion criteria, and it is recruiting the patients for the study. Even AI is creeped into that much of this thing as far as research is going on.
Thank you, Saravana Bhava, sir. If there are no more questions from the panel or speaker, we would like to hand over the session back to Atik sir and Jayantan sir, our ARC chairman as well as editor. Over to Atik sir.
Thank you so much. Very difficult to do a concluding remarks for a session. This was literally like a highlight. Every talk was like a highlight. I'd like to grab a little bit of Jayantan's work also. I'll be failing in my duties if I don't thank Jayantan and Prasanna for coming forward with this wonderful program. So thank you so much. Wonderful choice of speakers and topics. I personally enjoyed this and learned a lot from all the speakers. Thanks to all the speakers. Jayantan, sorry for having grabbed what you had to talk, but this was part of my this thing. I'll be failing in my duties if I don't tell that. And thank my Master Stroke Coordinator Nagalakshmi also for this. So to begin with, Devendra sir's talk on choosing a niche in clinical article. Well, that was a absolutely wonderful talk. He was telling on how to choose something that you like. You have to be specific about what you talk, which will help you to stand out. I felt those three terms were literally the highlight of his talk. So you cannot do something which goes with the flow, which is something ongoing, already there everywhere. Try to identify something which will help you to stand out from the crowd, which will be easy to move forward and identify yourself. And sir was telling how his fellows grew from step to step and help them to move forward. So that was really wonderful. Then moving on to the next topic, Adit talking on difficulties of private practitioner. Well, me as a private practitioner also had the same thought process. Well, an individual practitioner, your volume is less, you will not be able to compete, but all the pros and cons were clearly analyzed, and the power of autonomy. When Pramila madam was sharing her views on the difficulties which their students or fellows face with regards to getting clearances here and there. So the power of autonomy lies with individual practitioners. So though they have certain drawbacks, of course you can start. And Adit was telling the significance of statistics. That is something which really needs to be highlighted, because till about 2 decades back, India actually was lagging behind with data, with publications, though we were doing wonderful work. So the power of statistics really needs to be understood. He said that was one of the main reasons why he was not able to publish initially. Later on, when he understood the game, he was able to move forward, and he was telling the significance of doing retrospective data analysis for individual practitioners, and it is easy to begin with. So that was again a wonderful talk. Then moving on to Harini, about the first research article, she was telling about trying to be really perseverant and trying to keep pushing, about how that beautiful picture got rejected 7 times, that lens extrusion. Well, it's really hard to believe why that got rejected, but still that kept pushing her, and she kept moving forward. She was telling the importance of cover images, which will help you to start. And two things which I feel, though philosophical, are very important. She was saying, mentors don't come to you, you go to your mentors. Something very, very important. So in these sort of things, identifying and getting the right mentor is something very important. Everybody emphasized on the importance of mentors and how peers will help. So analyze your patients, get a good mentor, talk to your peers, move forward, was what she said. So something very, very interesting and important from her talk. And moving on to Dr. Narayanan's talk on scope of research fellowships. Well, normally people think you would take a fellowship without research, you save 6 months, earn money in that 6 months, finish early, start, do your next work. But then the pros of doing a research fellowship, he put it in a very light way. I feel that was actually the take home for that talk. You get more surgeries, you get more importance, you're a wanted person. Of course, he was telling the difficulties what a person will face. You have a long day, start at 7 o'clock, evening 5:36. When you're totally drained, you have to do data entry. Of course, everything comes with a cost. The cost of doing all that work, of course, you will repay. Thank you, Narayanan, was very important and an interesting talk on why to do fellowships with research. The next talk by Dr. Stephen, telling about quantity. So actually, I also had written what Pratibha had mentioned. So quantity with continuously doing quantity, you definitely become qualitative. And he was telling about the importance of building momentum, show to your peers, and the significance of not falling to predatory journals. That is something very, very important, has to be highlighted. Just for the sake of having a publication so that you move forward, thinking these predatory journals will help, should not be taken into consideration. So that go the extra mile, people are always there to help identify people. Don't fall prey for these, were wonderfully highlighted by Dr. Stephen. Then moving on to Dr. Sindhuja's talk, well, something very interesting. She said, after you make your, how to build your momentum, something very nice. She said, you analyze your first publication, go through it again and again. You will be able to identify more data to analyze and one more paper to get out from your first paper itself. May not be one, you may be able to actually get 2 or 3. So that is something really interesting. And one more significant thing what she said was the power of networking, attending conferences, CMEs. Even Prasanna always, I remember whenever he talks and mix, he will say, my journey started in WSOC. I don't remember the year, but he always keeps saying. So the power of networking and attending conferences is something that is very, very important. And do go down when your publication gets rejected first. Almost all speakers told, I think the average number of rejections for all these budding wonderful researchers was 7. If I had, I don't know why that number 7. I'm a fan of number 7, but the number 7 has been unlucky for many. I think Harini also said 7. Adit also said 7. Why number 7 is unlucky? Prasanna, we need to analyze that.
Lala for a reason, sir.
So number 8 is lucky. 7th time yours is rejected. The 8th time it gets accepted. So wonderful. And Niranjan, again, your talk was very different, Niranjan. You were telling about prioritizing simplicity. Something really nice. Normally, when we think of a publication, generally we are forced to think we will choose a topic which no one has done. That is what is the initial thought process. But then you gave a totally different outlook. You said choose something that is simple, which will not kill your time, which will not strip your finances, which will help you to do your first publication. Something really nice, a great thought process that you've said, because people start in a big way and then collapse halfway because of funding issues, because of not being able to move forward. So those are nice concepts which you said. Start simple, and significance of grants again was told by many of the speakers. Those really needs to be analyzed. I will request the editorial team, if possible, to make a summary of all the talks in a maybe in a write-up also, and pass it on to people. This presentation will be there on YouTube. All the speakers and the panelists, kindly pass it on to everyone. I strongly feel it's a wonderful set of speakers, and this will really move forward. Eagerly looking forward to another session. Over to you, Dr. Jayantan.
Thank you, Dr. Atik. That was nicely summed up. So I'll just make it very crisp. So on behalf of both the TNOA ARC and the TJOSR team, it's my pleasure to express our sincere gratitude. First, I would like to thank our esteemed panelists and the speakers for sharing their valuable inputs, insights, and knowledge with us. Dr. Aditreya Varman, Dr. Narayanan Balakrishnan, Dr. Devendra Maheshwari, Dr. Mary Stephen, Dr. Sindhuja Murugesan, Dr. Harini Krishna, Dr. Niranjan Karthik. And I would like to express my sincere gratitude for the panelists who share their experience and for giving a valuable inputs to for all the topics. Dr. Saranabhava sir, Dr. Shubha madam, Dr. Pradeepa Devi Nivyan, Dr. Karthikeyan Mahalingam, and Professor Dr. Pramila ma'am. Thank you so much. That was, and of course, to my real buddies, I'll come to that later, Prasanna. That was really an enriching experience. We are deeply grateful for their time and the expertise. I also want to express my gratitude to the TNOA President, Dr. Arul sir, ARC Chairman, Dr. Atik, and my dear teammates and today's conveners, Dr. Prasanna, Dr. Samir, and Dr. Nagalakshmi, for their hard work in planning and executing this webinar in a nice way. The dedication and efforts that made this event possible. Thanks to you, to the technical support of the Numerotech, who ensure the smooth running of this webinar. Finally, I would like to thank all of you for attending and participating in this webinar. Thank you all for being here, making this webinar a success. We hope you found this session informative and engaging. Do share this with your friends who missed watching it today. It will be available in the YouTube, and we will be also sharing it through our mailers. Thank you so much.
Thank you, sir.
Thank you. Thank you all.
Thank you so much, sir.
Manjula ma'am,
Thank you,
you can
everyone.
stop recording and this thing, ma'am. I'll request everyone to stay forward. We'll take a group snap.
Sure, doctor. 1 second. Doctor.
Yeah. I'll request all of you, as Prasanna said, please
1
turn
second.
on
1
cam.
second. 1 second.